First is what we call back dominant pain. Most commonly, this pain radiates down the back to our butt and or around the hips. Patients just have pain in the back, and others can sometimes feel the pain all the way down the leg.
Dr. Pohl, would you please explain the difference between acute pain and chronic pain?
Certainly. Acute pain is, think of it as useful pain. It's functional pain. It's like an alarm clock going off. It says something's wrong, you've sprained your ankle, don't walk on it, or you've cut in your finger, you need to do something about it. Chronic pain is unending, lifelong pain. Talking about chronic spinal pain like back pain or neck pain, abdominal pain from scar tissue, chronic headaches, fibromyalgia, and illnesses like that.
Talk about the use of pain medications and what are their dangers?
Well, the main medications that we get into problems with are the opioids. Those are the narcotics. Think of them as heroin pills. They're very potent substances. They take pain away, physical pain and emotional. Long-term use of these opioids causes a series of negative side effects, especially for the elderly. They cause like a backfire effect. People develop tolerance, so they stop working as well. Physical dependence, meaning they can't stop safely without medical assistance. And they actually rebound and cause more pain with the drug than without the drug.
What are the signs of dependence on opioids? Are there behavioral changes? Are there brain changes?
Dependent on pain relievers, if we go too long between doses, we're going to end up with more pain, with anxiety, with sweating, with stomach cramps and diarrhea, sleeplessness. I mean, it's a whole series of terrible symptoms.
What are your opinions, medical opinions, about the use of medical marijuana for pain?
There's no such thing as medical marijuana. It's not medication. Medication comes from a pharmacy, is prescribed and dosed appropriately by a doctor. That is not what we have with medical marijuana.
I know that there are at least 20 or more modalities of treatment that patients can use in order to alleviate pain or reduce it at least significantly. What are the main ones that you have found work the best for people?
The best treatments for pain are movement. So invariably, it hurts when I move, so I don't move. The less I move, the less I can move. The stiffer the tissues get, the less oxygenation. So exercise, starting with just stretching of the joints and making sure that we have mobility, but then really getting our heart rate up and stimulating our cardiovascular system makes more of the endorphins that are in our brain. So exercise, movement, and there's a variety of ways. I mean, it can be at a pool, it can be at a gym, it can be lifting, it can be Pilates, or it could be some of the Eastern style exercises like yoga or Tai Chi or Qigong. Very, very crucial to move. The second is decrease inflammatory substances that go into your body. We're talking about food, and the most inflammatory substance is nicotine in tobacco products. If you smoke and you have chronic pain, quit smoking. Moving on, there are inflammatory foods and there are anti-inflammatory foods. The third area is working on our thoughts and feelings. Learning how to mindfully practice meditation is probably the number one thing that somebody can do to decrease their pain.
As a final statement, what would you like to say?
First, acknowledging all pain is real. Secondly, that emotions drive the experience of chronic pain, and until and unless you deal with the emotions and the thoughts related to pain, you will not get better. Third, opioids, the painkillers that you're getting from your doctor, may be making your pain worse. So please talk to your doctor about reconsidering the doses that you're on and perhaps decreasing or coming off them under medical supervision. Fourth, if we're going to treat pain, we want to make you better. So get moving, activity, do things that are good for you.
If you need more information, I would suggest this book, A Day Without Pain by Dr. Pohl. It is excellent. It gives you all the alternative therapies that you would need. And also, if you need further information, if a loved one has pain and is taking any kind of pain medication that's becoming a problem, to call the Las Vegas Recovery Center. Helen Lieblein, SCATV, Anthem Alive.